is the Buying Value Initiative, where 19 private healthcare purchasers and their representatives came together with CMS as a purchaser and other federal partners and identified a common set of performance measures that they would use for value-based purchasing. So where CMS has been trying to get to value-based purchasing, now we've got private sector trying to align with each other and align with CMS so that the measurement that's used will meet the needs of whoever is buying health care from you as a frontline provider. We've been working over the past year within NHS to try to align measures across agencies, even within agencies. So our motto for the Measurement Policy Council is measures that matter and minimize burden. And we've got a long way to go, but we've really been working hard to try and places where we have the same measure be used across all the different programs and then get rid of measures that are slightly different but require a lot of effort to then calculate and submit. And CMS has been really doing some terrific work at trying to align the requirements for the various programs that they have so that if you report once, it can meet the needs and requirements of multiple programs. I just want to spend a minute or two talking about some of the private sector successes that we've seen. The first one is really Kaiser Permanente. I thought it was, and this is a California example, I thought it was fabulous that their shared decision-making pilot really promoted a 50% reduction in the number of elective hip replacement surgeries over a month program. And that doesn't mean that people weren't getting care that they wanted. It really was about people understanding the risks and benefits and being able to make appropriate choices for themselves. Another example that comes to mind that some of you may have seen recently is the Care First Blue Cross Blue Shield initiative, where they really established patient-centered medical homes, reduced costs by $8 million, and documented improvement in the quality of care. We see these as examples that are addressing the aims of improving better care and at the same time lowering costs and making quality care more affordable. Strategic opportunities were identified in conjunction with our private sector colleagues at the National Priorities Partnership, and those three opportunities that cross all the priorities were establishing a national strategy for data collection, measurement, and reporting, organizational infrastructure at the community level so that geopolitical communities could really drive improvement, and then ongoing alignment around payment and delivery system reforms. So examples that are on this slide really focus on some of the things that we see happening that support those strategic opportunities. And I think the first is really the national strategy for data collection, measurement, and reporting. So in addition to the work that we've been doing to try and align around measurement, around data collection and reporting, the Office of the National Coordinator is just ready to release a improvement strategy that's going to really help guide our efforts at electronic clinical quality measures. And the organizational infrastructure is the work of the Health IT Regional Extension Centers, where they're working with 45% of the nation's primary care providers to adopt and fully use EHRs. Again, part of this is really getting to the point where we have interoperability in the delivery, the healthcare delivery system, but then also across delivery systems and with public health, et cetera. There's a lot of work that we have to do, but interoperability is one of the top of the list in terms of getting to the point where those who are really caring for people have the information that they need, regardless of the source, in order to be able to really maximize that person's care. And as far as payment and delivery system reforms go, really, at this point, through the Center for Medicare and Medicaid Innovation, 5 hospitals, 30,000 physicians, and 2,500 other clinicians are participating in one of these new delivery models, such as the ACOs. So I think we've got a lot that's wrong, and we still have to learn what the effects are and monitor for untoward consequences. But we've really begun to get some traction, I think, in these on 6 priorities. So really, the story I wanted to tell and encourage you to, all for Quality website and read the annual progress report if you haven't done so already. But with that, I think I'll turn it back to Anne.
Great, thank you, Joelle. So, as you heard Nancy say, helped kind of tell the story about the National Quality Strategy, the way that it's being shared in this year's annual progress report. And I think one of the points that's really important to emphasize here is that this is, in fact, a national quality strategy. It's not necessarily a federal strategy. The government and the Health and Human Services is a big part of its implementation. So that's why we invited the California Department of Healthcare Services to present to you today. And representing that group is Dr. Neil Kohatsu, who serves as Medical Director, and Dr. Desiree Bachman, who serves as the Chief Prevention Officer. We're going to share their story about quality improvement with the state of California with everyone on the phone and webinar today. California, take it away.
Thank you so much. We really appreciate the opportunity to just share a little bit, and we've certainly been inspired by Dr. Wilson's work, and I'll touch upon that. In fact, on the next slide, a little bit of the background regarding some of the drivers on why our Department of Healthcare Services, which oversees Medi-Cal, the name for the Medicaid program in California, why opted to put time and effort, which we think is well worth it, into developing a quality strategy. And my first point is that we were certainly inspired by the work of Dr. Wilson, her team, and all the collaborators around the country that have created